What do abnormal brain waves mean for epilepsy diagnosis? Imagine your brain as a busy city with electrical signals constantly moving along roads. When these signals follow a normal pattern, everything runs smoothly. But sometimes, these signals become irregular or sudden, which can point to underlying issues like epilepsy. That's where an electroencephalogram, or EEG, comes into play. It's a simple test that records the electrical activity of your brain through small electrodes placed on your scalp. During an EEG, the electrodes pick up the brain's electrical signals and send them to a machine that creates a visual pattern of brain waves. In people with epilepsy, the EEG often shows abnormal patterns called epileptiform activity. These include spikes, sharp waves, or spike and wave discharges. These patterns are like electrical red flags that suggest the brain has a tendency to generate seizures, even if a person isn't actively having one during the test. It's important to understand that abnormal brain waves on an EEG are a helpful clue but not a definitive diagnosis on their own. Some abnormal patterns can appear in other neurological conditions or even in healthy people under certain circumstances. Conversely, a normal EEG does not necessarily mean a person does not have epilepsy because seizure activity might not happen during the recording. Sometimes seizures are infrequent or only occur under specific conditions, making them hard to catch in a short test. Certain EEG patterns are more closely linked to specific types of epilepsy. For example, generalized spike and wave discharges are often seen in generalized epilepsy syndromes, which affect the entire brain. Focal spikes or sharp waves indicate that seizures may originate from a specific area of the brain. Photosensitive epilepsy, a type where flashing lights can trigger seizures, shows abnormal responses to visual stimuli during EEG testing. Additionally, unusual rhythms like theta or delta waves in abnormal locations can suggest particular epilepsy syndromes or brain dysfunction. To improve the chances of detecting abnormal activity, clinicians may use techniques like hyperventilation or flashing lights during the test. Sometimes, extended monitoring with video EEG or ambulatory EEG over several days is recommended. This allows doctors to observe brain activity over a longer period and increases the likelihood of capturing abnormal waves linked to seizures. When diagnosing epilepsy, doctors don't rely solely on EEG results. They consider the EEG findings alongside the person's medical history, descriptions of their seizures, and imaging tests like magnetic resonance imaging or computed tomography scans. These imaging studies can reveal structural brain abnormalities that might cause seizures, providing a more complete picture. In summary, abnormal brain waves seen on an EEG are signs of unusual electrical activity in the brain that often relate to epilepsy. They help doctors confirm a diagnosis, understand what type of seizures a person might have, and decide on the best treatment plan. However, because EEG results are just one piece of the puzzle, they must be interpreted carefully by specialists. Remember, every person's brain is unique, and only a healthcare professional can provide a diagnosis tailored to individual circumstances. If you're concerned about epilepsy or seizures, it's always best to consult with a medical expert who can guide you through the appropriate testing and care.